Hey guys, so in this video we're going to go through a couple of techniques just to help mobilise the ankle joint. If you've got a stiff ankle, there's a couple of techniques that we can use just to mobilise that to improve movement. So Glenn, what will we do with these techniques?
So what we're essentially going to do here, we're going to, as you said, we're going to imagine we've got a client with a very stiff ankle joint. And when I say stiff, I mean particularly either dorsiflexion or plantarflexion restriction. And what can work really nice in that instance is to create a little bit of a longitudinal traction between the talocrural joint. Yeah, so as we know, the talocrural joint is largely responsible for the majority of plantar flexion and dorsiflexion. So if we can create a little bit of traction at that joint, potentially increase a little bit of circulation, synovial fluid, that kind of stuff, then it might have a positive effect on movement. Yeah, so I'll show you two ways. The first way, I'm going to be working on Patrick's right ankle, so I'm going to put my left knee under his knee, and notice I'm very close to him. Yeah, so there's no point doing this technique if there's a lot of distance apart. So I'm going to bring his leg nice and close into my body. My left hand is going to just stabilise the shaft of his tibia as well, so that there's no movement laterally when I do the technique. I'm going to stabilise him here. I'm going to hold him nice and close. My elbow's clamping him tight to my body as well. And now my right hand is going to hook over the top of his talus, and I'm going to just essentially shift my body weight towards my right to create a traction at the joint. So I'm holding, everything's nice and tight, locked in now, and then I'm just going to shift to the side. Yeah, I'm going to take it a little bit further out, and I'm just shifting my body weight, taking my weight onto my right foot, and creating a longitudinal glide on his talus, creating a bit of traction at the talocrural joint. Okay, if I was getting some benefits with that and some improvements, I wanted to take it a step further. I can come into this position. I'm going to now hook my right hand again around in front of his talus, but I'm going to bring his foot into slight eversion. So that kind of locks the joint play slightly, and then I'm going to hook my right hand around the back of his calcaneus, and from there I'm just going to lean myself back. Yeah, and I'm creating a little bit more pressure now. Longitudinal traction at the talocrural joint again. And I'm really trying to ascertain what that end feel is like. Is it very stiff? Do I feel any movement there? And what you'll often find, especially if you compare to the non-affected side, you'll feel a restriction and a tightness here, and as you carry on with this technique, it will start to feel more similar to the other side.
And you're using your body really to create that traction,
yeah,
rather than using your arms.
I've got a little bit less space than I normally would have here, but I'd have my arms nice and locked out, nice soft knees, and then I'm just shifting my body weight back. So what you don't want to be doing is trying to pull too much with your arms. Yeah? And you can ask them to stabilise themselves on the couch if you wanted to add even more pressure as well. But they're two really nice techniques for longitudinal traction at the talocrural joint, and that can be effective for loss of plantar flexion and dorsiflexion.
Great.